Hello friends. Welcome back. Today we are going to cover the approach to the infective causes of massive hemoptysis in the emergency department. First, let us see what is the definition of massive hemoptysis. Life-threatening hemoptysis is the one that results in any of the following: significant airway obstruction, significant abnormal gas exchange, or hemodynamic instability. Approximately 150 milliliters, roughly a half cup of blood, expectorated in a 24-hour period. Hemoptysis at a rate greater than or equal to 100 milliliter per hour. It is important to note that 90% of massive hemoptysis originates from the bronchial circulation and only 5% from the pulmonary circulation. The remaining 5% is from the aorta or other systemic arteries. Moving on to the pathophysiology of hemoptysis, you should know the four main mechanisms leading to hemoptysis: erosion of blood vessels, inflammatory destruction, increased vascular pressure, or tumor invasion. Now let us try to understand further with the help of case scenarios. Case 1 is a 43-year-old female from Arunachal Pradesh. She presented with a history of cough and low-grade fever for 3 months. She developed massive hemoptysis and was brought to the emergency. This is the chest X-ray that was done. What would you suspect? Also know that the sputum for AFB and gene expert was negative. If you are still clueless, let me give you some more details. Patient gave history of consumption of undercooked freshwater crabs and crayfish. Her stool and sputum showed presence of these eggs. This is a case of perigonomyosis. Serology was positive for perigonomyosis. Pathogen for this infection is Paragonomys species that are also called lung flukes. This infection is endemic in East Asia, Southeast Asia, some parts of Central and South America. These flukes result in disease by formation of cysts and granulomas in lung tissue, and they also cause erosion of blood vessels in the lungs, resulting in hemoptysis. Chest X-ray findings closely resemble that of tuberculosis. It can produce cystic lesions, pleural effusions and fibrotic lesions visible on X-rays. Treatment is tablet praziquantel 25 mg per kilogram given orally, thrice a day, for 2 days. Let me now take you to the second case, that is a 35-year-old male farmer. He presented with a history of high-grade fever and chills for 3 days. He developed massive hemoptysis. His chest X-ray is given here. He was diagnosed with atypical pneumonia and put on treatment. On 3rd day of admission, his wife also developed high-grade fever. The resident doctor who saw him first also developed fever. Also, this swelling was noted in the inguinal region of the patient. Do these findings ring a bell? This is a case of plague, and the inguinal swelling is a bubo. Pathogen of plague is Yersinia pestis. It is now a rare infection but still remains significant because of its epidemic potential. Plague is restricted to certain geographic regions, and therefore any fresh cases of fever and hemoptysis, especially in people having close contacts, must ring a bell. Plague results in severe pneumonia leading to hemoptysis. Human-to-human transmission is possible in patients with pneumonic plague. It can infect healthcare workers delivering care to the patients. Diagnosis is made using sputum smears, culture and serology. PCR can also be done for definitive diagnosis. Treatment of plague is antibiotics like aminoglycosides, doxycycline, and quinolones. Close contacts must be given chemoprophylaxis, doxycycline or quinolones for 7 to 10 days. Hope you are enjoying the information provided in this lecture. Now we will move to the next case. This is a 30-year-old male tourist who returned from Andaman Nicobar Islands. He complained of fever, headache, conjunctival suffusion, myalgias, and developed massive hemoptysis. This is his chest X-ray. What comes to your mind? This is a case of Andaman hemorrhagic fever. Any idea what is the causative agent? Andaman hemorrhagic fever is caused by Leptospira. Patients present with short history of fever of 1 to 2 days duration followed by massive hemoptysis and has very high mortality. It is predominantly seen in Andaman and Nicobar Islands. This was the reason that the Indian Council of Medical Research established the Regional Medical Research Center for Leptospirosis in Andaman Islands. This center now has the world's largest repository of leptospires. Sporadic cases of Andaman hemorrhagic fever have been reported from coastal regions of Tamil Nadu and Gujarat. Early initiation of penicillin group of antibiotics and supportive therapy can be life-saving. We do not wait for the definitive diagnosis of leptospirosis for starting treatment because diagnosis is time-consuming and the infection spreads fast, causing high mortality. We have covered 3 rare causes of massive hemoptysis till now. The next case is a 35-year-old female from Delhi. She came with a fever of 3 days duration in the month of August. She has petechial lesions all over her skin and has joint pains and myalgias. She also developed massive hemoptysis. What would you think can be the cause? I think you guessed it right, this is a case of dengue hemorrhagic fever. Pathogen is dengue virus, which is endemic in tropical and subtropical regions. Virus causes increased vascular permeability, coagulopathy, and thrombocytopenia. Diagnosis is made using serology, IM for dengue, PCR and NS1 antigen. Treatment is mainly supportive. When we talk of viral hemorrhagic fevers, we must know other viruses that can cause massive hemoptysis. These are not yet reported from India but are life-threatening. They include Ebola virus disease, Lassa fever, Marburg virus disease. Pathogenesis of these viruses include vascular endothelial injury, coagulopathy and multi-organ failure. Diagnosis is made using PCR and serology. Now let me take you to the next case. This is a male patient aged 55 years who is suffering from hematological malignancy and has developed neutropenia, post-chemotherapy. He presented with fever, cough, and massive hemoptysis. Clinical findings include fever, tachycardia and crackles all over the chest. Chest X-ray is given here. What do you think is the diagnosis? This is a case of invasive pulmonary aspergillosis. His CT scan showed nodular lesions with surrounding ground glass opacities, also called halo sign. Laboratory tests for this test include elevated galactomannan levels and culture for Aspergillus species. Management includes initial stabilization with airway protection and hemodynamic support. Specific treatment includes antifungal therapy, voriconazole. Supportive care includes neutropenia management and potential surgical resection for localized disease. Now when we talk about massive hemoptysis, we must always keep in mind tuberculosis that causes cavitary lesions, vessel erosion, and diagnosed using sputum AFB, gene expert, culture and imaging. Also, massive hemoptysis can be a manifestation of necrotizing pneumonia, that is a form of cavitary pneumonia most commonly caused by Streptococcus pneumoniae, Staphylococcus aureus and Klebsiella pneumoniae. Diagnosis is made using sputum culture and blood cultures. Lung abscess and bronchiectasis can be the other causes massive hemoptysis. The underlying pathogenesis is liquefactive necrosis and cavity formation. Common pathogens involved in lung abscess are anaerobes and Staphylococcus aureus. Bronchiectasis-associated infections include Pseudomonas aeruginosa and Haemophilus influenza. Diagnosis involves sputum culture and imaging. Now, you must realize that irrespective of the cause of massive hemoptysis, the management approach involves prompt airway protection and hemodynamic stabilization. And when we have established a specific cause or made a differential diagnosis, we must institute definitive therapy that includes antibiotics or antifungals based on pathogen, antitubercular therapy for tuberculosis, antiviral therapy for hemorrhagic fevers, for example ribavirin for Lassa fever, antiparasitic therapy like praziquantel or triclopentazole for perigonamiasis. Surgical interventions may help in cases of refractory hemoptysis or massive bleed. Bronchial artery embolization is a minimally invasive option for controlling massive life-threatening hemoptysis. So, this was all in brief about life-threatening causes of massive hemoptysis in emergency departments. Hope you like my video. Do like, share and subscribe my channel for more of such videos.